Okay.
to witness.
Okay, Teresa, the doctor's here now.
Yeah, hi, I'm Dr. Krimnajad. I'm one of the residents on the neurosurgery team. Just a couple of things. So everyone's been talked to about what the presumed diagnosis is.
Correct.
Okay. So based on the diagnosis of the B-cell lymphoma, the hematology team that came and visited with Ms. Donzi was requesting several tests because lymphoma can be common with certain kinds of infections. It's prudent just to check for them. So it's a hepatitis panel, hepatitis B and C, and also an HIV test. The hepatitis test we went ahead and ordered already. The HIV test, we actually need a consent form saying that you guys are okay.
I have had that.
You have had that test?
The HIV
Test.
Okay.
in Texas.
He needs you to sign the form, that's it.
Yeah, so this is just saying that you give us permission to go ahead and proceed with the HIV
Yes.
test, and just need you to understand that you know, the result of the test will become a permanent part of the medical record, and it would be, if it did end up being positive, it would have to be reported to the Missouri Department of Health. So if you guys are comfortable with that, we can get that form signed. And then the other form is for permission to do a lumbar puncture today. That was another request from the oncology doctors. It's just in your lower back, they would insert a needle in there and draw out some cerebral spinal fluid. The purpose of that is they want to send that for some further testing. It's called flow cytometry, just to help to confirm diagnosis of the type of cancer, lymphoma. So that's what this consent form is for. Risks of that procedure are similar to other medical procedures: pain, bleeding, infection, damage to nearby structures.
Same kind of test you said.
Well, probably Daddy
Similar.
did have that test. Mom, this is what everyone calls a spinal tap.
Spinal tap, almost
So,
like, yeah.
okay, so you know, some people have it for just to find out what's in their central nervous system. It's a normal test people have.
So they're essentially going to roll you on your side. They're going to numb that area up a little bit and just inject the needle in there to access that area where your spinal fluid is and draw some of that out.
She's
I'm sure Daddy had it several.
Does
Dad had cancer.
show up in that?
Well, we'll send the fluid and they'll do testing on that to just try to confirm that it is
Doesn't cause
lymphoma.
any cancer in the back, does it?
Does it what?
no,
That-
no.
No.
So risks of that procedure, as I mentioned: pain, bleeding, infection, damage to nearby structures. There's also an increased risk of headache. Sometimes where you make that puncture hole, some of the fluid can leak out of there and can cause significant headaches, which can last for several days, you know, and sometimes requiring a blood patch, but usually not. So do you understand those risks that I reviewed, Teresa?
Yes.
Okay, and are you comfortable to proceed with both of those, both the HIV test and the lumbar puncture?
Yes.
Okay, all right, we'll go ahead and get these forms signed then. Thank you very much.
Mom, you're okay, right?
You okay with it?
Hey, Mom. Those
Thank
are
you,
just,
guys.
You know, they
Thank you,
looked up
Doctor.
the spinal tap the other day, remember?